Does your teen seem forgetful, confused, or overwhelmed by even simple tasks? Well, this brain fog is not your child's laziness. It is a real thing and it is a real challenge, but there is a way to help. In this video, I'm going to talk about what brain fog is, which is one of the most common and frustrating symptoms of functional neurological disorder, short for FND. However, with the right steps, your child can start to think clearly again. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online group coaching program to help teens with FND and their parents get their lives back because they can get better from FND. So in this video, what is brain fog? Let's talk about that. So brain fog feels like this cloudy, sluggish mind, and it's really hard to focus for your teen and remembering things or even find the right words to say. So all of those things are the symptoms of brain fog. And with FND, it's kind of like the brain is really stuck in this overprotective mode. Sometimes that leads to using up too much energy and it leaves less room or less energy to think clearly. So it's almost like your teens are trying to run a marathon in super foggy, and no matter how hard they work, nothing really is moving in any direction. So many teens actually told me, it feels like I'm failing at everything, even though I am trying so hard. And this is fundamentally the thing that teens experience with FND, especially the brain fog. Now, brain fog itself isn't necessarily the only thing that happens with teens who have FND. Brain fog can happen in so many different things like chronic fatigue syndrome, chronic pain, and things like that. But also brain fog is very, very common thing within teens who are experiencing FND. So why does it happen? Well, brain fog technically can happen because of the stress, not because the stress is causing FND, just to be clear, or poor sleep, or your teen's brain trying to protect her from slowing down. And it's sort of like a part of how FND disrupts the nervous system. So remember, in my YouTube channel, I talk a lot about what FND is, which is an umbrella term to describe this cross-wired communication problem between the brain and the body, even though physiologically and structurally your teen's brain and body are fine. But it is really the disruption and dysfunction of the autonomic nervous system, which is a neurological thing. That's why it's called functional neurological disorder, right? So kind of like imagining your brain is a computer, and when too many tabs are open, it starts to run very slowly. And this is what the brain fog is essentially about. So let's get to the bottom of this. I'm going to tell you 5 things that you can do. So specifically speaking of the 5 things, 4 things are the things that teens can do, like starting today, and the 1 thing that you as a parent can do. So now we know why brain fog happens. Let's talk about exactly what to do with it. In my online program, Teen FND Academy, I have a dedicated literally lesson about brain fog. And so I'm going to give you like 10,000 foot overview of what you can do, which is 4 steps that teens can take and then 1 thing the parents can do. So I'm going to start with the teens and then I'm going to end with the parent. Okay. So 1 for teen, you have to focus on the sleep quality, and it might be kind of big thing to work on. However, the day starts from the night before. So if you're already waking up feeling like a zombie because you're so tired, then let's work on the sleep. And it's not just forcing yourself to go to bed when you are feeling tired, but wired. I would call it twired. This is not the way to improve your sleep. Really, it starts with waking up at the same time, no matter what. That includes a weekend. And I have a separate video just talking about the 6 steps of sleep protocol. So make sure to check that out as well. But just to kind of give you the summary of it, you would wake up at the same time, no matter what. And that includes a weekend. And you would only go to bed when you're ready to fall asleep. It doesn't necessarily matter what time it is that you go to bed. As long as you're ready to fall asleep, that's when you go to sleep. So you're basically retraining your brain and body. The bed is a place to fall asleep, not the place to be frustrated. And no screen time, minimum 30 minutes before your bedtime, okay? And then ideally 1 to 2 hours before bedtime. You're basically, again, retraining your brain and body to wind down, that this is a time to chill out and fall asleep instead of continuing this tired syndrome. So step 4 is no nap time during the day. Step 5 is if you are not able to fall asleep, or if you can't fall asleep, then you would do something boring outside of the bed. So you're not staying in bed, like wide awake. And the last one, the number 6, is no caffeine or energy drinks, soda, any of that kind of stuff, stimulating stuff after lunchtime. If you can avoid altogether, great. But if you're already doing that, awesome. That's one less thing for you to do. But anyway, going back to these 4 steps, one is really focusing on the sleep quality. And number 2, since you're already alive, that means you're breathing. So why not slow down your breathing? And I'm not talking about do the deep breathing, because a lot of teens find themselves deep breathing not super helpful. Actually, a lot of teens tell me deep breathing makes them feel more dizzy and more like anxious and stressed. Well, because they're kind of hyperventilating. So the way I like to do it is just slow down the breathing pace. So really slowly breathe in for 4 seconds, but normal amount of air. So you're not like doing like a lot of breathing in, okay? And then exhale for 6 seconds. So you're spending more time on exhaling and really making sure the air is out of your system. So then that makes it easier for you to do the next cycle of inhalation and then so forth. I would say do the slow breathing 5 minutes a day. That's a good place to start. And if you're like, been there, done that, I don't like the slow breathing. Well, there's a mechanical way of doing it correctly. But for now, if you are so not liking the slow breathing, even though you're breathing like 24/7, you can do one of 2 things. A, you can blow bubbles. If that works for you and if it's more fun, go for it. And make sure to do it outside of the house, so you're not sleeping. And second one is you can hum or sing if that's your preference. The whole point is you're spending more time on breathing out. So that is really that. I mean, obviously, you're not going to be able to continue to breathe out for the rest of your life. You need to breathe in as well. But the focus here is on really breathing out. So that is how you would turn down the volume of this fight or flight to re-regulate your autonomic nervous system. So that's a slow breathing, step 2. Step 3, this is a common thing that a lot of speech therapists will tell you as a part of the cognitive rehab, which is basically chunking down the tasks into small pieces. So let's just say your parents are telling you to clean your room, for example, then that's like the big thing. Okay, that can be overwhelming and you're like, oh my gosh, like my house is like, wow, the tornado just came in, so I don't know where to begin, kind of thing, right? So instead of that, chunk it down to small pieces. For example, pick up your socks, make your bed, and take out the trash, right, out of the room, and open the curtain or blind, that kind of thing, like really into small chunks. So then you're just focusing on one thing at a time instead of one giant thing at a time that you kind of have to think about. Remember, when you don't have brain fog, it's easy for you to do, but because you have a brain fog, kind of need a little bit of the smaller and then easier tasks to begin with. But remember, when you continue to do that, you're basically building back up to how you were functioning. So you don't really end there forever. So that's a step 3. Step 4 is something related to slow breathing, but I like to do it this thing called 5, 4, 3, 2, 1 grounding technique. Super easy. So you're basically focusing on 5 senses. So things like look around and then name 5 things you can see in where you are right now. And tell me 4 things you can touch, around you. And tell me 3 things that you can hear. And tell me 2 things you can smell or want to smell that makes you feel good. And one last one is tell me 1 thing you can taste or want to taste that makes you feel good. So those are the things that you can sort of go through. And it doesn't matter what order. So it could be like 5 things you can taste, like 4 things you can smell, it doesn't matter what the order is, but do the 5, 4, 3, 2, 1 grounding techniques. It does not help you to have suddenly this brain energy kind of thing, but it actually helps you to calm down the nervous system so then you can have a little bit more energy down the road to help with your cognitive functioning, aka the brain fogs. Those are the 4 steps for the teens can do, okay? So focus on the sleep quality, slow breathing, and chunking down the tasks, and then grounding techniques. Number 5, this is one thing for the parents. Parents, I would say on the surface level, like big picture wise, just let go and stop over accommodating. And let me walk you through. Mini step 1, you're going to have a talk with your teen, specifically how your teen wants you to help her versus you assuming that you have to take on the caregiving responsibility. Yes, you're the parent. However, it has really to do with the teen's empowerment, which is absolute ingredient that's necessary for your teen to be resolving the FND conditions that includes brain fog. So why not start right now? Okay, so after the talk, encourage your teen to practice the 4 things I mentioned earlier. Okay, the sleep, breathing, chunk it down, and then grounding techniques. Okay, so have them practice that. And then for you let go. Stop focusing on this concern too much, because basically what's happening is neuroscience wise, you are cranking up this thing called RAS, reticular activation system. It's the thing, that part of the brain in your brain that will basically turn on to continue to focus on the thing that you want to continue to focus on. So as long as you're focusing on, oh my gosh, my child is having this brain fog and then having short-term memory issue and they can't think and can't remember all of that stuff, then you're basically sending a message to your brain to continue to focus on the thing that is not working. And guess what? How is that related to your teen? Well, there's a clear science to it. Your experience is directly contagious, actually a lot more contagious than any virus out there on the planet. So the way you are presenting yourself, even overtly or covertly, like directly or indirectly, as long as you have that worry and then you're constantly focusing on that, then guess what? Your child is going to continue to focus on that. And I bet you that's exactly what you don't want to do, right? So you let go. And I will say in my Teen FND Academy program, this is the most part for the parents to let go of the control. So you're not the only one if you're having a hard time, okay? However, what you can do is that while you're letting go of that control, you can also practice these 4 strategies that I teach to the teen, with or without your teen. That's exactly what you can do. So you're basically modeling yourself. Yes, this is just a 1 chapter of our book. It does not have to be entire book, right? And then even though it's frustrating, remember, this is just going to pass. This is not going to define who you are as a family or who your child is going to be. So just remind yourself, and because your brain is constantly activating this reticular activation system, whether you like it or not, why not focus on something that you want to focus on rather? Meaning your child is learning, your child is getting stronger, right? You are building more focused brain along with your child. So that's exactly what you can do to actually help your teen towards a resolution of FND. And it is true, many teens feel very frustrated or even defeated when the brain fog holds them back. However, what they're doing is they are reminding themselves that this is not defining their abilities or who they are. This is just a temporary challenge they're going through. So at the core, the teens in my program, they're literally working to re-regulate their autonomic nervous system on a regular basis. So they're building this strong foundation, and then parents are doing the same thing side by side. So they're both and all building this strong foundation towards not only resolving the FND conditions, but also really getting their life back and then some. So what would be the one small change you're going to be making, either you or your teen, to basically fight off the brain fog? Leave me a comment below. And if this is something that you really want to get the help from an expert, you might be a good candidate for my online program, Teen FND Academy. Click the link below today to schedule a call to talk to me. Well, thank you so much for watching this video, and I will see you in the next video.